Assalamu alaikum, everyone. My name is Attas. I'm a fourth year medical student, and today I will be giving you the lecture of general anatomy of nervous system. It's a pretty easy lecture, so let's dive into it. I'll be so this presentation doesn't have questions, but when I send you the slides, it will be having some questions at the end for you to practice. And if you have any questions, this is my email. You can always ask me any question. Okay, so today we will be discussing the divisions of the nervous system, going over the neurons and neuroglia, central nervous system, peripheral nervous system, and finally some clinical cases. All right, so the division of nervous system. The nervous system is divided anatomically into central nervous system and peripheral nervous system. However, the peripheral nervous system is further divided into autonomic nervous system, somatic nervous system, and each of these nervous systems are further divided into sensory and motor systems. So what I mean by that is that the autonomic nervous system is again divided into sympathetic division and parasympathetic division, and we'll get into that. And the somatic nervous system is divided into sensory and motor nervous system. So what comprises each of these systems, the central and the peripheral nervous system? So the central nervous system is made up of only two organs, the brain and the spinal cord. Whereas the peripheral nervous system is made up of the cranial nerves that come off the brain and the spinal nerves that come off the spinal cord. So the central nervous system it has the brain and the spinal cord, and from the brain it branches off the cranial nerves, and from the spinal cord what branches off is the spinal nerves. So the peripheral nervous system is basically the link or the gateway between the central nervous system and the rest of the body. Okay, so some slides are slides that I made, and some slides are from the doctor's slide. Okay, so again, it says the same thing. The nervous system is divided anatomically into central nervous system, brain, and spinal cord, and the peripheral nervous system, which is the cranial nerves, the 12 cranial nerves. There are 12 pairs meaning there are two. So there will be one from the right and one from the left side, and spinal nerves, which are 31 pairs. It is divided functionally into somatic nervous system and autonomic nervous system, or sometimes they call it visceral nervous system. Now, this is concerning the peripheral nervous system, because if you remember, we said that the peripheral nervous system is divided into autonomic nervous system and somatic nervous system. The central nervous system cannot be divided more because it only consists of the brain and the spinal cord. So this whole point is telling you that the peripheral nervous system is divided functionally into somatic meaning that it controls the voluntary activities, meaning the skeletal muscles, and visceral autonomic nervous system controls primarily the involuntary activities, or the visceral organs, which are the thoracic and the abdominal organs. And each of these two systems, they include this. They have sensory and motor components. Now, the nervous system comprises of neurons and glial cells, and these are really important for the function of the nervous system. So the neurons are the functional and structural unit of the nervous system, meaning that without the neurons, the nervous system won't work. So and the neurons, they are specialized cells that are specialized in electrical signaling, meaning that they're responsible for transmitting and conducting signals, or what they call it electrical impulses. However, the glial cells are supporting cells. They're called supporting cells, and they support and serve the neurons, but they do not have the ability to conduct impulses. So they are not involved in electrical signaling. So this is mainly the difference between the neurons and glial cells. Neurons are mainly involved in the electrical signaling. They're all over the body, and glial cells, they're also associated with neurons, but instead they don't have the ability to conduct impulses, unlike neurons. Okay, so this is again the doctor's slide. It says the nervous system is composed of the neurons and neuroglia, as we said. The neuroglia, they are non-neuronal cells, such as the astrocytes, oligodendrocytes, and microglia. These three cells are called neuroglia. Okay. Neurons are the structural and functional units of the nervous system. As we said, we said that they're specialized cells. What do they specialize in? They specialize in reception, integration, transformation, and transmission of information or impulses. The information that the neurons transmit are in the form of impulses, electrical impulses. Okay. You don't need to know the numbers here or the numbers here. It just tells you, just shows you how large is the human brain compared to other species. Okay, now we said that like these two cells, they comprise the nervous system, the neurons and the neuroglia cells, or the glial cells. So what are the parts of the neuron? So this is like a typical sketch of a neuron. So the neuron has, this is the cell body, okay? And the cell body has the nucleus and other organelles. Also, the cell body has the dendrites. These processes are the dendrites. They receive the signal. They receive the signals from the other neurons. Okay, so this is the nucleus. This is the cell body. The cell body is this whole thing, but the nucleus is this white circle. The dendrites are what receives the impulses from the other neurons. Then the impulses goes through the axon. This is the axon, and what do you think is this? This is called the myelin sheath. Okay, so what is the purpose of the myelin sheath? The myelin sheath is there for the impulses to move faster. Okay, so the way the impulses move are not by moving through the whole axon, but because there are myelin sheaths all over the axon, the impulses, they move in saltatory conduction fashion. So in other words, they jump from one node to other node. What I mean by one node to other node, so if you can notice here, there's like myelin sheath here, there's myelin sheath here, there's myelin sheath here, but in between there's like the nodes of Ranvier. These are the nodes, they are the spaces that the myelin sheath doesn't cover. Okay, so how does the impulses move? They jump from one node to another, one node to another. Okay, so this is how the impulses are like the impulses move faster when there's myelin sheath, because they skip this part and they jump from one node to another. Okay, so again, this is the cell body of a neuron. This is the nucleus, the white circle. The organelles should be in the cell body. The processes are called the dendrites. This is the axon. This whole thing is the axon. The myelin sheath usually covers parts of the axon, and the space in between each myelin sheath is called the node of Ranvier. And finally, we come down to the axon terminal. These are the axon terminals, and this is the synapse where the one neuron communicates with another neuron, or with another organ. Okay. So again, this is the doctor's slides. It just says the same thing. Neurons consist of cell bodies. These are the cell bodies. This whole thing is the cell body, and their processes, dendrites and axons. So neurons, they have the cell bodies. there are two processes in a neuron. The dendrites are called dendrites are one process, and the axons are the other processes. Okay, the processes. Cell bodies are located in the gray matter of the CNS, and their collections are called ganglia in the PNS and nuclei in the CNS. And we'll get to that. But what they refer to here is that these cell bodies, where you can find them in the CNS, or in other words, the brain or the spinal cord, is in the gray matter. So the gray matter is full of these cell bodies. Okay, and more than one cell body is called ganglia. Okay, this is what they refer to by collections. So collections are like multiple cell bodies, and they're called ganglia in the peripheral nervous system and nuclei in the CNS. So whenever you see like cell bodies, like a collection of cell bodies in the CNS, they're called nuclei. But if they're in the PNS, they're called ganglia, or ganglia are the plural form of ganglion. Okay. Dendrites are usually short and these are the processes, the dendrites and the axons. The dendrites, they're usually short and highly branched. You can see how highly branched they are, and they carry impulses towards the cell body. So they carry the impulses from here all the way to the cell body. Axons are usually single. You can see how they're single only, and they have like fewer branches, unlike the dendrites, and they carry the impulses away from the cell body. So the impulses, they come from the dendrites, cell body, and then the impulses move away from the cell body all the way to the axon terminals. Now the neurons can be classified into two classifications, if it makes sense: anatomical classification and functional classification. The anatomical classification, you can classify neurons into three types of neurons. Bipolar, meaning that it has two processes. One dendrite, this is the dendrite, and this is the axon. Okay, and these are found in like special sensory organs, like the olfactory or the smell epithelium, the retina, the eye, and the ear. Okay. So usually in these organs, you would find that the neurons there are bipolar, meaning they have like two processes, one dendrite, the cell body is in between, and you have the axon. The second type of the neurons, or the anatomical classification of neurons, is the pseudo unipolar neurons. And they have like one process which divides into central band that functions as an axon and a peripheral band that serves as. So they have like only one process. So if you can see, this is one whole process. However, it divides into like a branch that functions as an axon. Okay, so yeah, pseudopolar, they have like only one process, and this process has like the axon, and it has like the process itself has like two branches. One that is a central branch that serves as an axon. Okay, this is a central branch that serves as an axon, and the peripheral branch serves as a dendrite. Okay, and these type of neurons, that you find them in the peripheral nervous system, the sensory ones, and the spinal and cranial nerves, ganglia. The third type of neurons are the multipolar neurons. And these they have several dendrites from the name, several dendrites, meaning they have like multiple dendrites, and so basically the multipolar, from the name multi, it means it has several dendrites and one axon. Okay, and these you mostly find them in the motor cells and the anterior and lateral horn of the spinal cord and the autonomic ganglion cells. So from this slide, what you need to understand is that what bipolar pseudo-unipolar and multipolar neurons have like bipolar. It's called bipolar because it has like two processes. Pseudopolar because it has only one process, but it has like two branches. Multipolar because it has multiple dendrites but one axon. And you need to also memorize the where are they found. Like sensory, they are found in the olfactory epithelium, retina, and inner ear. And pseudo-unipolar in the sensory neurons of the PNS and are found in the spinal and cranial nerve ganglia. And multipolar in the motor cells in the anterior and lateral horns of the spinal cord and autonomic ganglion cells. Yeah, so this is for the anatomical classification. The functional classification, so all neurons, you can classify them functionally into somatomotor. Somatomotor meaning like somatic and motor. Somatic, remember we said somatic means voluntary voluntary actions. Motor means they're giving actions. Okay, so GSE means general somatic efferent. Efferent means towards the body. So the impulses are going to the body or to the organs. So the somatomotor neurons, they conduct impulses to the skeletal muscles of the body. And how did we know that the impulses are to the skeletal muscles? Because first of all, they're efferent. Efferent means to the body, whether they are to the skeletal muscles or whether to the organs. And somatic. Somatic means to the voluntary muscles, which are the skeletal muscles. Yeah. So, and you need to memorize where are they found. So in the anterior horns of the spinal cord and the motor nuclei of the cranial nerve. The other type of neurons, they're called the general visceral efferent. Visceral means to the organs of the body. Whether they're in the thoracic or the abdominal organs. And efferent, we said towards the body. So these type of neurons, they will be conducting impulses to, not from, to, because they're efferent, to the glands, blood vessels, and smooth muscles. Preganglionic sympathetic are found in the lateral horn of the spinal cord. So the preganglionic sympathetic neurons, they're only found in the T1 to L3, and the post so preganglionic sympathetic are found in the lateral horn of the spinal cord and post ganglionic in the sympathetic ganglia. Yeah, so you would find the preganglionic sympathetic neurons in the lateral horn of the spinal segments T1 to L3 and the post ganglionic in the sympathetic ganglia. Somatosensory and viscerosensory. Why are they called sensory? Because they receive like the impulses are conducted from the organ to the central nervous system. So this is why they're called afferent. Afferent and efferent. Afferent means towards the central nervous system. It takes the impulses to the central nervous system, and efferent from the central nervous system to the body organs. So somatic means we said somatic to the skeletal muscles. So these GSA, general somatic efferent, they take the impulses or the information from the skin or the skeletal muscles, okay, to the CNS. Viscerosensory or GVA neurons, they receive the impulses from the organs of the body. Okay, so both of these neurons, they receive stimuli from the external and internal environment. The interneurons, from the name, you can expect that they are in between these neurons. So these neurons, they interconnect the motor and the sensory neurons within the central nervous system. Okay, now we're done with the neurons. Let's move on to the neuroglia. We said that the neuroglia, they're supporting cells, or they do not conduct impulses. They do not have the ability like the neurons to conduct the impulses or to be involved in the electrical signaling. So the neuroglia, they are multiple cells that are called neuroglia. You have the oligodendrocytes, and their function is to form the myelin sheaths. This is what we talked about before, the myelin sheaths that wraps around the axon. So what makes the myelin sheath are the oligodendrocytes. The other cell is the astrocyte. The astrocyte mainly is responsible for the blood-brain barrier, and the blood-brain barrier is really important because it doesn't allow all substances to go to the brain. Okay, and this is like a protective function. It has other functions too, but mainly its main function is to form the blood-brain barrier. The microglia it acts as scavengers, so you can call microglia as the macrophages of the brain. Okay, they have like the same function. Ependymal cells, they create barriers between compartments, and they're a source of neural stem cells. So they give rise to neural cells, as well as they create barriers between the compartments. So these are mainly the neuroglial cells. Oligodendrocytes, they form the myelin sheaths. Astrocytes, they form the blood-brain barrier. Microglia, they are the macrophages, so they're responsible in the immunological reactions in the brain. They engulf like bacteria or whatever is in the brain, or in the nervous system, and the ependymal cells. Now, in the central nervous system, what forms the myelin sheath is the oligodendrocytes. This is what we said. But in the peripheral nervous system, what forms the myelin sheath is the Schwann cells. So in the central and the peripheral nervous system, you would have these three cells in both the central and the nervous system and the peripheral nervous system. But what is different is the oligodendrocytes. Oligodendrocytes in the central nervous system are responsible for myelin sheath, but in the peripheral nervous system, it is the Schwann cells that are responsible for the myelin sheath formation. So this is what do you think is this? This is a central or a peripheral nervous system? It would be a peripheral nervous system. How did I know that from only seeing the picture? Because you can see that it says that this is a Schwann cell, and Schwann cell, you would only find it in a peripheral nervous system. However, if this was a oligodendrocyte, you would call this a central nervous system. Yeah, now this is the myelin sheath. You can see how it's wrapping the axon. Yeah, now myelin sheath is the fat-like substance forming a sheet around the nerve fibers of the axons. It is formed by Schwann cells in the peripheral nervous system and oligodendrocytes in the central nervous system. And they wrap around the axon so that they function as an electrical insulator. And I will show you now in the next slide how the impulses move from one node to another node. And this is mainly the function of the myelin sheath. It increases the speed of transmission of impulses. Yeah, so this is what I was talking about. You can see that this is, let me orient you. This is the myelin sheath. This is the cell, the Schwann cell. You can see how it's wrapping around the axon, causing forming the myelin sheath. You can see this is the node of Ranvier, node of Ranvier, node of Ranvier. And the impulses, how do they move? They don't move along the entire axon, but they move in a saltatory conduction. They move from one node to another, okay? Okay, so now let's move on to the central nervous system. We said that the central nervous system is made up of two organs, the brain and the spinal cord, right? Yeah, so the brain is enclosed within a cranium or a skull. So you know that the brain is it has like three parts: this cerebellum, and the brain stem. It has the cortex. So the cortex is the outside part of the brain. So this is the cortex. this outer part is called the cortex, and it's composed of the gray matter. You can appreciate how gray it is. And this gray matter, it consists of the nerve cell bodies, the dendrites, and the neuroglia. Okay. And the interior part, so we said that this is the outer part, it's called the gray matter. So what should the interior part be called? The white matter. Okay. The white matter, it has the axons that forms the tracts and the pathways, and also the ventricle. These are the ventricles that are filled with cerebrospinal fluid. So again, the brain itself is enclosed within the skull, and the outer part of the brain is called the cortex. It has the cortex. Just give me a second. Yeah. So the central nervous system, the brain, is enclosed within the skull. The brain has like three parts. The cerebrum. This is the cerebrum. Okay. This is the cerebrum. The cerebellum is down there. Okay, and the brainstem is it connects the brain to the spinal cord. The brain itself is the outer part of it is called the cortex, and it is the gray matter. The gray matter, it has the cell bodies, the dendrites and the neuroglia, or the supporting cells, and the interior part, or the inner part of it, it is the white matter. Why is it white? Because remember we said that the axons are wrapped with the myelin sheath. These myelin sheath are fats, and the fat, they appear white. So this is why they are called white matter. Yeah, so this is mainly for the central nervous system. The other major organ that makes up the central nervous system is the spinal cord. It is cylindrical. It is also enveloped by meninges. It has a cervical and lumbar enlargement, and this is the reason there's cervical and lumbar enlargement is because most of the nerve supply for the upper and the lower extremities comes from the cervical and the lumbar spinal nerves. So this is why there's like enlargements in the cervical and lumbar segments of the spinal cord. It has centrally located gray matter in contrast to the cerebral hemisphere, and peripherally located white matter. I'll show you in the next slide what this means. And has a conical end known as conus medullaris, and ends at the level of L1 to L2 vertebra in the adult, and L2 vertebra in the newborn. You need to remember the levels of the conus medullaris, okay? And I'll show you what the conus medullaris shows in a picture. So let me move this. Okay, so this is concerning this point. It says that the spinal cord has centrally located gray matter. You can see that the gray matter of the spinal cord is in the center. However, in the brain itself, we said that the gray matter are the outer part, but the inner part is the white matter. So this is what they're referring in that point. It means that the gray matter in the spinal cord is centrally located, but in the brain it's peripherally located. The opposite is for the white matter. The white matter in the spinal cord is peripherally located, but in the brain it is centrally located. The conus medullaris is the lower end of the spinal cord, so it looks like a cone. This is why it's called conus medullaris. And for adults, it ends at the level of L1 to L2, but in newborn, it ends at the level of L3. So this is like a cross-section of the spinal cord. We said that general somatic efferent means that the impulses are going towards the body, towards the organs of the body. Somatic means to the voluntary skeletal muscles. So this should be motor neurons. And these neurons, the motor neurons, are located in the ventral horn. You can see here that the general somatic efferent motor neurons are located here in the ventral horn. Now, before I talk to you about these neurons, let me orient you. So this is called ventral horn. This is dorsal horn, and sometimes there's a lateral horn here, like at the sides of the gray matter. So this is a ventral horn, dorsal horn. Sometimes there's a lateral horn. This is a ventral root, and this is a dorsal root. Okay, ventral root, dorsal root, ventral horn, dorsal horn. Ventral means for anterior. This is another word for anterior. Okay, so the general somatic efferent, we said that they're in the motor neurons in the ventral horn. The general visceral efferent means they're going to the body, to the organs. Visceral to the organs of the abdomen or the thoracic. So these should be preganglionic sympathetic in the lateral horn. Okay, this is number 2. This is what I meant by lateral horn. Okay, the general somatic afferent and general visceral afferent, these are sensory neurons. They conduct the impulses from the organs to the central nervous system. So they should be sensory in the dorsal. The sensory, they are always in the dorsal ganglion. Okay, so the brain, remember when we said the spinal cord is enveloped by meninges? Yeah, this is the same for the brain. The brain and the spinal cord, they're like protected by like 3 layers of connective tissue that are called the meninges. And the way I remember them is by DAB. Okay, starting from the outside, the dura mater. This is the dura mater. Okay, then arachnoid mater, and then the pia mater. So the space below the dura, it should be called subdural space. This is the subdural space. The space below the arachnoid mater is called the subarachnoid space, and this is the space. And then you have the pia mater, and pia mater is like is in like close. It is like sticked into the brain, like it is glued into the brain. It's very difficult to separate the pia mater from the brain. However, the arachnoid matter and the dura mater, they're not they're not close to the brain as the pia mater. So the function of these 3 meninge layers is to surround and protect the brain and the spinal cord. So these meninges, they should be in the brain and the spinal cord, and they contain the subarachnoid space, which is the space between the pia mater and the arachnoid mater, and it is filled with CSF or cerebrospinal fluid. Peripheral nervous system. We're done with the central nervous system. Now, peripheral nervous system. We said that the peripheral nervous system, it consists of the cranial nerves and the spinal nerves. The cranial nerves, they come off the brain, they branch off the brain, and the spinal nerves, they come out from the spinal cord. The cranial nerves, there are 12 pairs that are connected to the brain. This is why they're called cranial. They're connected to the brain rather than the spinal cord. They have the motor fibers with cell bodies located within CNS. We said that cell bodies that are located within CNS, they are called what? Nuclei. And they have sensory fibers with cell bodies that form sensory ganglia located outside the CNS. They emerge from the ventral aspect of the brain, except for the trochlear nerve, cranial number 4, I mean. what this point mean is that all cranial nerves, they branch off the brain from the anterior side, except for the trochlear nerve, which comes off from the posterior side. Okay? The cranial nerve, we said that there are 12 pairs, meaning that there are 12 nerves. Okay. Pairs, we said that pairs they mean they come off the brain from the right and the left side. Okay. Now the cranial nerves, there are 12 cranial nerves. You have to memorize what each number corresponds to the name. For example, cranial nerve 1 is called olfactory nerve, and this is responsible for smell. It functions in detecting smell. Cranial nerve 2 is called optic nerve, and it's responsible for vision. 3, 4, 6, oculomotor, trochlear, and abducens nerves. They're responsible for moving the eye, or responsible. They control the muscles of the eye. The trigeminal nerve is responsible for controlling the muscles of chewing and the skin of the face. Facial nerve, it controls the muscles of the facial expression, taste sensation, and salivary glands. 8, vestibulocochlear nerve, it's responsible for hearing and balance. 9, glossopharyngeal parotid gland, and it takes the senses from the posterior 1/3 of the tongue. Why posterior 1/3? Because the anterior 2/3 of the tongue is the sensation from the anterior 2/3 of the tongue is controlled by the trigeminal nerve. Okay. The number 10 is the vagus. It involves in swallowing, regulating heart rate, breathing, and digestion. 11, accessory nerve. It controls the sternocleidomastoid and trapezius muscles. Trapezius muscles are responsible for elevating and depressing the shoulder. Sternocleidomastoid, the sternocleidomastoid muscle, it helps you in moving your head to the right and to the left. The final nerve is the 12th nerve, the hypoglossal nerve, which is responsible for moving the muscles of the tongue. So the reason behind you moving the muscles of the tongue is because of the hypoglossal nerve. So luckily there's a mnemonic to remember all of these nerves. The mnemonic is once one takes the anatomy final, very good vacation starts happening, and each letter corresponds to the nerve. Here, we said that the 11th nerve is called, the 11th cranial nerve is called the accessory nerve, but here it's S because it's spinal accessory nerve. It's the same thing. It's just that they put it there to make the mnemonic sound right. So what you need to know from here is just to know the numbers. Like 1 corresponds to cranial nerve, 1 corresponds to olfactory, 2 optic, and their functions briefly. Neuroganglia. We talked about this before. We said that ganglion means collection of neuron cell bodies. If it is in the PNS, it's called ganglion. If it is in the CNS, they're called nucleus. Ganglia is the plural form of ganglion. There are 2 types of ganglia, sensory and autonomic. There are only 2 types of ganglia, sensory and autonomic. The sensory ganglia, it contains the cell bodies of either pseudo-unipolar or bipolar sensory neurons, and the autonomic, they contain the postganglionic autonomic, whether they're sympathetic or parasympathetic neurons. Neurons in the ganglia are derived from, you don't need to know this because this is embryology. Yeah, spinal nerves. We said that there are like 31 pairs, and the way that spinal nerves are divided is that for each part of the spinal nerve, for example, the cervical region has like 8 cervical spinal nerves. Thoracic region has 12 pairs of spinal nerves. Lumbar region has 5 pairs. Sacral region has 5 pairs, and the coccygeal region has only one pair of spinal nerves. And these nerves, they are formed from the dorsal and ventral roots. Each dorsal root has a ganglion within the intervertebral foramen. So this is the spinal cord. We said this is the dorsal horn. This is the anterior horn. This is the lateral horn. So this should be the ventral root, and this should be the dorsal root. This is what they're referring to here. The spinal nerves, they are formed from the dorsal and the ventral roots. So the dorsal root and the ventral root, they combine to form the spinal nerve. And this spinal the dorsal root has ganglion. Yeah, and they're connected with a sympathetic chain by the white and gray rami communicants. So we said this is the dorsal root, this is the ventral root. Okay, they combine to form the spinal nerve, and this is the gray, and this is the white rami, primary rami. So they communicate with the sympathetic. They communicate with the sympathetic by the gray and the white, communicant rami. Okay. They're divided into ventral and dorsal primary rami. The ventral rami enters forms the plexus. Dorsal rami innervates skin and deep muscles in the back. Okay, so this is the how the spinal nerves they form. They basically form from the dorsal root and the ventral root. They combine to form the spinal nerve. Okay, after that, if they want to connect to the sympathetic chain, they can connect through the gray and the white communicant rami. Okay. If they move forward, there will be the ventral. Wait, let me. So this is after they give off branches to the gray and the white communicant rami. They form the ventral primary rami and the dorsal primary rami. Dorsal meaning back or posterior. So you can expect that these nerves will supply the skin and the deep muscles of the back. However, for the ventral primary rami, they will form the plexus, the cervical plexus, the lumbar plexus, the lumbosacral plexus. So this is how the spinal nerves they form in general. We said that the dorsal and the ventral roots, which are these dorsal and ventral roots, they join to form the spinal nerve and the intervertebral foramen. The dorsal root, it has the axons of the afferent neuron cell bodies located in the dorsal root ganglion. It carries sensory information, and the strip of skin it supplies is called the dermatome. We'll come to that in a second. The ventral root, it is the motor. So always the dorsal root is the sensory, the ventral root is the motor. This is what you need to understand. The dorsal root, it has the axons of the efferent neuron cell bodies located in the ventral horn, and they will go to innervate the skeletal muscles. This is what we said before, at the level of T1 and L2, there will be lateral horn. And because there is lateral horn, the axons of the efferent neuron cell bodies will be there. And they will innervate the smooth muscles and the glands in the internal organs, okay? Finally, the clinical cases, which are two cases, the dermatomes, dermatomes and the intervertebral disc. The dermatomes is a strip of skin innervated by one dorsal root ganglion. So this whole skin is innervated by a skin that is innervated by one dorsal root ganglion is called a dermatome. For example, this region, this area, it's a skin, and it is innervated by the sensory. It is innervated by L2. The same goes for each strip of skin. Each strip of skin is innervated by only one nerve. This is T2, this is T3, this is T4. So, but however, this does not apply to the whole body, the dermatome concept. Some parts of the body, there's an overlap between the dermatomes. For example, the middle finger, it has innervation from the C6, C7, and C8. So for you to test or to lose the sensory part of that middle finger, you have to cut the C6, the C7, and the C8. So again, okay, again. So each strip of the skin has only one dorsal root ganglion that is innervating it. This is called dermatome. Okay, so this whole thing is called dermatome. This is dermatome. This is dermatome. T4 dermatome, T5 dermatome, and etc. But however, there's an overlap. So, like the middle finger, this is an example that he gave. The middle finger, it is innervated by C6, C7, and C8. So for you to lose the sensory innervation to the middle finger, you have to cut C6, C7, and C8. This is for the dermatomes concept. Rhizotomy is the surgery of cutting off dorsal roots. So let's say a patient, someone developed for some reason pain in his middle finger, again using the same example, and he tried all medications, but nothing worked. So they do a procedure called rhizotomy, where they destroy or they cut the nerves that are supplying that middle finger, which is the C6 and C7 and C8, to reduce the pain. This is in a nutshell the rhizotomy procedure. Finally, the intervertebral disc. Let me show you. So this is a normal intervertebral disc. So this is the intervertebral disc. This is called the nucleus pulposus, and this is the disc annulus, or it has another name, but it's called disc annulus. So if there's a defect in the disc annulus, the nucleus pulposus will impinge, will instead of being enclosed by the disc annulus, it will move towards that defective region and will compress the spinal nerve. We said that this is the spinal cord. It has the ventral horn, ventral root, and the dorsal root forming the spinal nerve. However, if the nucleus pulposus compresses the spinal nerve, it would cause a problem, or would cause a clinical condition called the intervertebral disc herniation. So the intervertebral disc herniation consists of prolapse of the nucleus pulposus through the defective annulus fibrosis into the vertebral canal. Okay, and when it does this, it impinges on the spinal roots, causing pain, loss of reflexes, and muscle weakness. Sometimes it causes paresthesia or loss of sensory inputs. And this is how it looks. So you have the disc annulus or annulus fibrosis. There's a defect at this region. So because there's a defect at this region, the nucleus pulposus, it prolapses and it compresses the nerve root, causing pain, muscle weakness, or loss of reflexes to that region of the spinal nerve. Okay, so this is mainly an overview of the nervous system in general. I will be adding some questions at the end for you to practice. It is a simple lecture. It doesn't need much memorizing. If you just understand how each nervous system is connected to the other nervous system, it would be a piece of cake. And if you have any questions, my email is here. I put it in the beginning. Yeah, my email is here. You can contact me at any time. Yeah, that's it. Thank you.